Today, one of the nation's most aggressive COVID vaccine mandates takes effect as New York State healthcare workers are forced to get the shot or possibly get fired. But as the severe staffing crisis looms, Governor Kathy Hochul is ready for reinforcements, preparing to bring in retirees and even the National Guard to replace as many as 94,000 unvaccinated employees. Our next guest is a CT scan technician at Staten Island University Hospital. John Matland joins us now. John, thank you for being with us this morning. As I understand,
good morning, Will.
Good morning to you. As I understand, you're comfortable sharing this information. You are, as of yet, unvaccinated. And so today, what does that mean for you? Will you be showing up to work? Will you have a job? What happens starting today?
Well, right now for today, I'm not set to show up. So I'm currently going to be supplying them with a religious exemption, and I wait to hear from them as exactly how to proceed. But I know many coworkers are showing up, and what they're going to face, they're really unsure. And I have to say, even for the health system itself, that they're unsure and they're in a really bad position from these mandates.
No doubt. Let's actually play that out, John. Let's play the downstream effect, but starting with your coworkers and you, once you get the answer on your potential religious exemption. Is it your understanding, is it your colleagues' understanding then that the hospital system will say, you're fired, we don't need you today, go home? What will they meet at the hospital should they show up without a vaccination card?
From my understanding, that it's just we're all moving to termination. They might be doing it throughout all of the health systems in a cascade fashion, where it's going to start with some of the staff. They're going to keep some of the staff to help onboard the retirees that will be taking over the National Guard as a way of training, essentially. So people will be training their replacements, and then they will be weaned out as well. It's a terrible situation, and it's supposed to be, happening in the name of health, and it's just not going to raise health at all in our state, and it's going to be a very big problem for people as we're heading into this time of year where everyone tends to get sick.
Right. That's a very important point, by the way, that not many people remember this disease. COVID is, like any other flu, seasonal. You see spikes, you see troughs on the charts that kind of follow seasonal and geographic patterns. So we're seeing what's coming for the North. We're seeing what's coming for states like New York. What we know is coming is a staffing shortage, to your point. This is a man-made crisis. They're saying goodbye to so many hospital staff, and in their place they're bringing in, as you mentioned, retirees and National Guard. Will those type of reinforcements be able to handle our healthcare system, or what kind of compromise are we now facing?
So there's many ways to look at this. So they could eventually be up to speed to do that, but they have to get through that process. If you're a nurse and you transfer, say, from a floor nurse to the ER, you have months of being preceptored. So you still have to learn the ropes in your own facility. So we're getting people from out of state. We're getting people that have been retired for many years, and they're even saying different from foreign countries with the similar licensure that they're going to be putting people in the mix. And all of this, again, is in the name of health, and it's a man-made emergency that they're signing up for, essentially.
Saying goodbye to unvaccinated American workers to bring in foreign workers to replace them. There's just something very wrong about what's happening in America right now. John, we wish you luck going forward with your job. Thank you so much.